Welcome, welcome. My name is Andrea from PMD Alliance, and today I'm going to be your host, your Oprah, to talk to Brandon about his experience with Adaptive DBS. And we are very excited. This is the first presentation that PMD Alliance has done about Adaptive DBS, and one of the first in the country as well. So I will preface Brandon's comments by saying the decision to do any treatment plan is personal for all of you, between you and your family and your doctor. But what do you need to make that decision? You need data, but maybe you also need stories, and you need the perspective of someone who has been in your shoes. So that is the reason and the spark behind today's presentation. We want to hear from Brandon what went through his mind, ooh, literally and figuratively. And what was this like? And really invite you to ask lots of questions. He said that he is an open book, and we're so lucky to have him and just appreciate you being open and authentic and vulnerable to share your story. So, Brandon, tell us a little bit about yourself.
So, as she stated, my name is Brandon Mahaffey. I am 49 years old. My journey with Parkinson's started, I was diagnosed just after my 40th birthday. So that was a nice birthday present. But yeah, I had DBS in July of 2022. And I'm married, have two grown daughters and two pups. So
And whereabouts do you live again?
I live in Hershey, Pennsylvania. So the land of chocolate.
Okay, I've been to Hershey Park. And what did you do as your career, or maybe you're still working?
um, I was a licensed pharmacist in the state of Pennsylvania, and for a couple years I worked as a retail pharmacist behind the counter. And then I made the transition to working in a corporate office for one of the largest um, pharmacy chains out there. I was the director of pharmacy asset protection, which doesn't really describe much what I did, but I was in charge of all the internal drug theft investigations for my company. So, yeah, every day was a little bit different and pretty crazy.
Mhm. And you shared that you got a surprise for your 40th birthday, the
Yeah.
diagnosis. Were you right at, it sounds like you were right at the had some pretty impressive titles, pretty high up in the company. Where were you in your career when you got that diagnosis?
Pretty much at the precipice of, the apex of my career. I finally had achieved the job that I always wanted, and I was doing really well, was very well respected in the field. I was being invited to speak at different conferences for the job. So yeah, I was doing really well, and yeah, came as an absolute gut punch when I found out. I actually found out because, as most people, and especially young onset patients, I didn't know what was going on with my body. I was a competitive triathlete, and the final thing, I ran a half marathon with my brother-in-law, and typically I would beat him, but he whooped me by like 7 minutes in that event. And after all joking and everything ended, I said to him, I said, buddy, if I didn't know any better, I feel like I'm dragging the whole left side of my body. And a couple more things, I used to get up at 4:30 in the morning and hit the gym for 2 hours, and all of a sudden I couldn't get out of bed. My muscles ached. I was getting cramps, and yeah, so I went to my doctor, and I said, Mike, I don't know what's wrong, but something's not right. And it took 2.5 years to get, we went sleep study, endocrine, cardio, like the whole battery of everything. And neurology was the last stop on that train. And, you know, as I was going through what I call the chicken dance, I could clearly see that there was something wrong with the left side of my body. But I'm thinking, pinched nerve, something along those lines. And when my neurologist rolled back in her chair, got in her drawer, and rolled forward with this red and white Parkinson's Foundation folder, I just remember thinking, who's that for? And it was for me. So yeah,
Mhm.
quite a
Thank you
shock.
for sharing. Yeah, I bet. I bet. And uh, after the diagnosis, um, how were those first few years? And, did medication work well?
Yeah, for the first few years, it was, I mean, after the initial shock of the diagnosis, and, you know, especially as with young onset, basically it turning your world on end. But the first couple years, and being on the Cinemet, the carbidopa levodopa, it controlled my tremor, and I felt fairly good. Um, it was more of an annoyance than anything. But yeah, the first couple years were okay, and I kept it to myself, just because I didn't feel like sharing. I didn't want to have to explain to everybody, and um, yeah, but it was pretty tolerable and pretty easy to get through a day early on. Um, I'd say the first 3 years of my diagnosis were pretty good. After year three, started climbing in my dose of Cinemet, and of course, the longer the disease progresses, the more you need to elicit the same response. And the downside of that is you get a lot of unwanted side effects with that. And at the point that I, was seriously discussing DBS with my doctor, I was taking two. I was taking two of the regular release Cinemet 5 to 6 times a day, which is a lot. And because of that, I had to start taking other medications for the unwanted movements, the dyskinesia, and things like that. So it was getting harder and harder to hide that I was dealing with Parkinson's.
Mhm. I'm just curious, as a pharmacist, did you have, compared to maybe the rest of us, without that training, did you have a more, intimate knowledge of all of the medications and the side effects and things like that?
The medications and the side effects, yes. I'd be lying if I told you that I had a lockdown of knowing exactly how I was going to feel on different things, and that the side effects would be predictable. But I mean, someone explained to me that Parkinson's patients are like snowflakes. and everybody's journey is different. Everybody's response to medication is different. So it was, it's been a journey.
Mm,
It's definitely been a journey.
yeah. So why did you decide to have DBS and undergo deep brain stimulation?
It was a fairly lengthy process. I mean, you know, I'd be lying if I said that I jumped right into brain surgery. Um, I was very fortunate that my healthcare team and my movement specialists are very up on pretty much everything cutting edge on therapies. And we had discussed DBS earlier in my treatments, and I had said that I didn't, you know, I was of the mindset that I'm not bad enough. I'm not bad enough. And you know, at one visit, my doctor said to me, "You don't have to get to the point that you're so bad." She's like, "Live your best life now." And that really resonated with me because, you know, being a young onset patient, I did want to live my best life now, and not knowing what the prognosis and the progression is going to be like, I wanted to I wanted to live like a normal 40 something year old as much as I possibly could and enjoy the time with my family while my children were growing up, and you know, be able to take those fun world trips with my wife, and yeah, so it got to the point where I was taking such high doses of medication and multiple medications to control the side effects that I decided that I wanted I wanted more for myself and for my family. And after sitting through seminars and doing countless hours of research, it seemed like a very viable option for me for the short term of living my best life and for my long term prognosis. So,
Mm. So how many years after that 40th birthday diagnosis did you decide to do the DBS?
um, year six, year six, and keeping in mind that it took 3 years to get diagnosed. So, honestly, in my journey, it was from
Mhm.
onset of symptoms was about 9 years.
Mhm.
Um, but that was July of 2022.
Mhm. Okay. And you mentioned you were a serious triathlete.
Hmm.
You continued to exercise, I imagine, after the diagnosis?
I did as things got worse. And my movement symptoms, my stiffness, my slowness, all that continued to get worse. The workouts got less frequent, and I mean, I don't have to tell those that are suffering with Parkinson's disease. Every day's a new mystery of what's going to happen, what's going to hurt, what's going to cramp. So, yeah, that kind of went on the back burner. I loved it. I mean, I was a gym rat since I can remember. So part of deciding with DBS was I wanted to try to get some of that piece back to be in better shape, um, so that I could go on walks with my wife and hikes and do family vacations and things of that nature. So
Hmm.
yeah, that was a big piece of it.
Motivator to why to do the DBS. Okay. And so once you made the decision, what happened after that? I know from talking to many people, it's not like, okay, and then tomorrow, yes, today, and then tomorrow you head to the OR. What was,
No,
after you said yes, then kind of what happened with your healthcare team?
yeah. So had multiple meetings with my healthcare team. Um, Even though you decide that it might be an option for you and it's something that you want to do, you need to get with your movement disorder specialist and find out, is it a viable option for you? You know, there are multiple factors that determine whether or not you'll be a good candidate. From what was explained to me, people who respond well to the Cinemet and things of that nature tend to do better outcome wise of the DBS as far as the physical symptoms, the tremor, and one of the big things for me was I would get the dystonia or really bad muscle cramps and pain. Um, they also have you go through a cognitive battery of tests, um, and overall health of how well you're doing at that point, you know, will determine whether or not you're a candidate for the surgery. So it took a few months, but yeah, it. Being a healthcare professional, I was impressed at how diligent they were. You know, it wasn't just a, okay, you want to have it, let's just do it. They really made sure that you were a good candidate and that you were in good enough shape to have it done.
Cool. And had you had any major surgeries, any, I don't know, knee replacements or shoulders or anything with your triathlon career?
I've had massive reconstructive surgery of my rotator cuff on my right side twice. Uh, the second time I had it done was February, right after I had DBS, and yeah, I can
No
honestly
stranger
say,
to surgery.
oh man, no, I've had buku surgeries, and I can honestly say I thought the DBS surgery, all said and done, was easier to recover from than the shoulder surgery. I would have DBS a million times before I have this shoulder operated on again. I can tell you that much.
Mhm. Well, let's get into, yeah, what is the DBS surgery like?
Well, so I don't know if you can see, I don't have much hair anymore these days, but I have I call my racing stripes. So I have some scars here. They're not too abundantly apparent, but yeah, it's done in stages, at least with my experience and my surgeon. I don't know how it's done completely across the country, but my neurosurgeon, it was done in phases. They the process that he used. Um, some of the surgeons will have you completely immobilized in the surgery. He likes to do a 3D molded um, harness that attaches to your head. So phase one is getting CT scan, MRI, and having that printed for you exactly for your surgery, and that lets you move your neck during surgery when they want to move you. So that was kind of phase one. Then phase two, they put the leads or the multi-directional leads in the both sides of the brain, um, and the wire that comes down, they kind of in the next phase they wrap that all up over here, and then phase, and they give you about a week to 10 days in between. And then phase three, they bring the wire down and you get kind of like a pacemaker. It's kind of like, I don't know how old my audience is, but I'm old enough to remember the old flip phone, the Razor flip phones. It's about the size of one of the folded Razor flip phones in there, and that connects to the wire. And I don't think you can even see it. Maybe there, but yeah, it's a pretty. I mean, for brain surgery, you don't have pain receptors in your brain, so you have a little discomfort with the healing process of your incisions. The pacemaker piece, they have to go through some muscle in your chest wall, so that one hurt a little bit more than the other, but I don't know. I've had such good results from it. I kind of have like my wife calls pregnancy amnesia, so you can have the second one. I don't remember much of the downside to the recovery of the surgery piece, but they kept me one night in the hospital just to make sure that everything went well after they put the leads in. But other than that, everything was outpatient.
Mhm. I like that. Pregnancy amnesia. You have
I
brain
had
surgery amnesia.
brain surgery amnesia, but for the right reasons.
Yeah. Yes. No shoulders, no rotator cuff, though.
Oh man, no, I don't want that ever again.
Well, with the when you made the choice and did the DBS, did you choose the adaptive DBS right away?
So the device when I had it, adaptive wasn't even on the radar. Uh, I've come to find out it was in the technology that went in the device, but no, I had regular DBS initially. So I had the adaptive turned on a couple months ago. So, so yeah, I had a good run with the regular, and then they asked if I wanted to be one of the patients that tried the adaptive, and things were so good with the DBS, I was like, heck yeah, I'll try it out. So.
Mhm. Sounds like one of the comments in the chat said that Angela said she had DBS about a year ago and it's been miraculous. So she's saying it's hard to believe anything could get better. So it sounds like maybe that was similar to your experience.
So let me put it this way. If DBS is a delicious ice cream sundae, aDBS or adaptive DBS is like the cherry on top and all the fixings that you want along with it. It is, I'll give you a for example. So as life changing as DBS was, like you still have, your moments where, like for instance, when I would get up in the morning, I'd keep my ride terrier, the carbidopa levodopa extended release, on my nightstand with some water, so I could wake up in the morning, take my medication, lay there for about 15-20 minutes, and then get out of bed so that I was functional and not having issues. Now I get up, I roll out of bed, I come out, I make my own coffee, and sometimes instead of, jumping right in to take my medication, I'll be on my second cup of coffee before I even realize, oh, I didn't take my medication yet this morning. So, and I've had a few um, appointments to make sure things are going better. For those of you who have DBS, that you know about the battery changes and stuff like that, I've actually gained 6 months on my battery because instead of getting a steady state all the time of something, when I need it, it goes up. And when I don't need it, like when I'm sleeping and things like that, it goes down. So it's great. I really can't say enough good things about it.
Do you remember what it felt like when the adaptive DBS was turned on for the first time?
Well, I cried like wheat. It was it was something that I'll never forget. Like, people ask me all the time what it feels like to have Parkinson's. And again, Parkinson's patients being snowflakes, everybody's going to have a different answer. But for me, I was racked with pain in my shoulders and in my flanks. And I would explain it as, you know, when somebody like pretends like they're going to hit you and you tense up. Like I constantly felt like I was in a perpetual tensed up state. And I also explain it as like with your movements being slowed and things like that. I explained it. Imagine wearing a suit, but the suit is like covered with wet cement, you know? And when they turned on my DBS, it's like it just I felt like it all just melted. And it was life changing. It was truly life changing. I mean, there wasn't a dry eye in the room between my movement specialist and my wife and myself. It was a very emotional time.
Thank you for sharing. Um, Mateo was asking how physically active you are now, and maybe I'll expand that into, um, has the DBS, helped you get back to your triathlon days?
So I'm not quite back to doing triathlons, but I am back to being a gym rat. I teach a Parkinson's spin class 2 times a week, and I take a Parkinson's boxing class 2 times a week, and I spend probably about 5 out of 7 days lifting weights as well. So yeah, I'm down since since the surgery. I'm down about 40 pounds, and I, I can't even tell you how much better I feel. You know, it's given me back parts of my life that I had written off. Honestly, like one of my favorite things was riding my road bike. Now I don't get out on my road bike anymore just because I don't want to get hit. One and two, balance. DBS doesn't help with the balance portion of things. But I'm riding the spin bike, which is as close as you can get to the real thing. And you know, there's something really satisfying about being able to do something you love and helping other Parkinson's patients in the process. It's something I hold very dear to my heart, and it's very very special.
So,
So I
Mateo,
hope
it
that
sounds like
answered the question.
yeah, it sounds like you're very physically active.
Oh yeah, and I go for walks with my wife. I mean, we our last vacation, I think I clocked like 20,000 steps a day, which like I was having trouble walking part of the way around the block before DBS. You know, it's again, it's my experience. It's my outcome, but it's been life changing for me.
Mm. And Monique and Jason asked, what do your off times look like now?
Not every day is perfect. I mean, it's still Parkinson's, so oft times I get breakthrough tremor sometimes in my right hand, and if I really overdo it, like I helped my daughter move into an apartment last weekend, and I, I mean, normally when you help somebody move at 50 years old, you should be pretty tired, but I was pretty wiped, and I was feeling it. Um, but my off times aren't nearly as bad as what they were. I mean, the best way that I can put it was I felt like I was a slave to my medications. And what I mean by saying that is I would take it and in 4 hours, like I could feel it when I took it, like 15, 20 minutes, I could feel it hit and come on. and I could feel it coming off as well. With the DBS, I mean, I still take medication along with it, so I want to make sure I'm clear about that. But it's smoothed out. It's not as dramatic of the peaks and troughs, if you will, of on and off time. Um, yes, I still have them, but not nearly as abruptly. I hope that answered the question.
Mhm. That did. And Barbara, I think that might answer your question too, but if you have a follow-up, Barbara, put it in the chat. And then, okay, so Mitchell wanted to know, how often do you recalibrate? And do you need to relearn how to calibrate after switching to adaptive DBS? I don't know if does that question make sense to you?
Yeah, yeah.
Okay.
So for those of you obviously who haven't had DBS, you would go. I would go in for my every 6 month neurologist appointment, and we they'd ask all the questions. I go through the tests and everything like that, and they would make adjustments if I was having tremor. I would go in with my notebook of stuff I wanted to discuss with my doctor, and we would hit each one of those, and they would make changes. They literally sit there. I put a harness on, like over my neck, cover my device, which is a VPN that lets them talk to my device, which is something that was really important to me. Like I wanted to make sure that some genius hacker couldn't just get into my device. They can't. You have to have a VPN that literally has to be touching your device for them to be able to get in there. So, but they would make tweaks right there on the spot with their iPad. And from the time I would go in to the time I leave, I was feeling, better than I was when I went in. And then you also have like a cell phone that you can make with a regular DBS. You can make adjustments within the parameters that your neurologist would set for you. So, for instance, I know my dad also has Parkinson's. He has trouble when he goes to dinner with a group because his speech is very soft. So if I wanted to, if I was having trouble with that, I could turn my device up tenth of a degree and have an easier time having a conversation at dinner. When it was done, I could turn it back down. The adaptive does that for you. It's really amazing. Now, I will say that it took, when I did have the adaptive turned on, it took 3 appointments over a month and a half to really, what I would say, dial it in. You know, it's I'm trying to think the word. It's not finicky, but it's you have an upper threshold and a lower threshold, and finding where that zone is of where you fit in those thresholds are the key to it. And I can tell you, for those of you who are considering it, your device not only writes or sends a signal, but with the adaptive, you have that brain sense mode, and your physician can add events and things of that nature. So when you were taking your medication, if you're diligent about all your markers, you mark when you take your medication, you mark when you feel like you're on and off time, you mark when you're feeling like you're having breakthrough symptoms, and all of those things. It's it's fantastic. Like once they got me dialed in, like I've been really really good, really good.
Awesome. So took like 3 appointments over the course of a couple months to get that, and I think your explanation of the thresholds is a great way to explain that. But
Yeah,
few appointments, but now you're golden.
yeah, and keeping in mind that I was one of the first to have this. So they were kind of learning some of the things as I was explaining how I was feeling. And, you know, based on some feedback from my neurologist, some of the things that I helped them figure out was what they thought was where they should start wasn't where they're starting people now, and they're getting it dialed in even faster. So pretty awesome.
Mm, awesome. And so how long were those programming appointments? And when is your next programming appointment?
My next programming appointment is in 6 months, and because I literally just had one, and the appointments were probably about an hour. Um, but it's not only was I just going in for the programming, we would go through the battery of all the things that you normally do during your neurology visits. So not the entire appointment was all programming. It was talking about how I'm feeling and things of that, making sure that, the things that DBS doesn't cover, the cognitive pieces and things like that, making sure that I'm still where I need to be.
Mm, okay. And let's see. We have a lot of good questions. Okay, so you said you're still on carbidopa, levodopa. And again, this is just for you. But someone asked if your dosage changed after DBS.
Yes, it did. After DBS, I switched from the regular release Cinemet to a drug called Rytary, uh, which is, I believe, going to be phased out here. I think it's going to go generic, but they came out with an even better, longer acting one called Crexont. Um, but my dose, I went from, what was I taking, 10 to 12 tablets a day, to I was down to the 195s of the Rytary. I was taking two of the 195s 3 times a day, which was a significant decrease for me. And I also was able to stop having to take amantadine, which they were giving me for the dyskinesias that the Cinemet was causing me. So I felt better on the DBS. My carbidopa levodopa dose decreased, and I was able to stop one of my medications. So
Okay, thank you. Jody wondered, did you have dyskinesia prior to DBS, and do you have dyskinesia now?
I did have the dyskinesia prior to. The only the only time I get dyskinesia now is if I can't remember if I took my medication and take another one by mistake, and I get a little too much uh, carbidopa levodopa, and I tend to get a little tweaky. But I put a lot of safeguards in place on myself now. Timers and counting out my doses for the day and making sure I'm paying attention, because honestly, before it was, I knew exactly when I needed to take it just based upon how I feel. Now it's like it's such a smoother on off that I have to be careful of, did I take it, didn't I take it, when did I take it. So it's a good problem. It's a good
Hmm,
problem.
okay. Mary Louise wanted to know, where did you have your surgery? So Hershey,
Uh,
did
yeah,
you?
I had mine at Penn State Hershey Medical Center, and my neurosurgeon was Dr. James McInerney.
Sounds like you have good relationships with your movement disorder specialist, the neurosurgeon, the whole team.
My healthcare team, which includes my movement disorder doctor, my neurosurgeon, and includes my reps from Medtronic. Um, like for instance, I told you I had to have my shoulder done right after. So one of the things that you have to be cautious about is after you have this device in an MRI, you have to make sure there's an MRI mode and everything like that. Well, my Medtronic rep met me at my MRI appointment and sat with me in the waiting room, helped me, showed me how to put my device in MRI mode, waited till my MRI was done, and then helped me put myself back in normal mode. So, and like I said, they were there. My rep was there when they turned me on, and it's just been a fantastic experience.
Wonderful. Another question. Well, we're going to keep it real. What PD symptoms does the adaptive DBS not help with?
Anything that would not be considered physical. So things it does help: tremor, dystonia, the generalized pain, the dyskinesias. Things it doesn't help with: stopping the progression of the disease, the cognitive pieces of, as that alpha synuclein protein builds and you get some of the cognitive pieces, and it does not help balance. Asterisks, and this is just me, because I was able to get back to the gym, lose some weight, take, you know, do some strength and conditioning things. My balance has gotten better because my muscles and my body are, my core are stronger. So it's not going to solve the balance issue, but you're you're more physically, you can be more physically active and help offset some of that.
Got it. Thank you. And I appreciate you uh, reiterating again, this is, your perspective
Yep.
and your experience. And there are some questions that I'm going to skip past because you're not a movement disorder specialist or a
Right.
expert in all of that, but we appreciate all of your that first person just angle on how it's working for you and
Yep.
your life. So for you, did your insurance pay for the DBS and then uh, the adaptive DBS when you turned that on?
It did, and I have private insurance through my wife, which I think is Highmark. So if that's any question, I mean, we had to pay our out-of-pocket deductible pieces, which you hit that like like that, but it was covered. All the follow-up visits, all the pre-visits for the cognitive stuff, all of that was covered.
And I have something to share from Medtronic. They said that DBS therapy is covered by most insurance plans, including Medicare, but your care team will work with you to navigate the insurance process and ensure that you get the right care. So, again, that's Brandon's experience, and there's so many different insurance plans and everything, but it is covered by most, and your care team would help you investigate that. Okay, let's see. Okay, here's a question from David. Um, let's see. So, what life are you seeing from the adaptive DBS between IPG changes? And he said you mentioned that you gained 6 months. So I don't know, does that IPG, is that individual programming? Or I don't know what IPG stands for, but maybe.
Uh, I know enough to be dangerous, I think, but all I know is that each visit that I would go in, my neurology team would let me know how much battery life I had left and before I would need a battery change. And when we went from um, when we went from the regular to the adaptive, nothing changed with the device. I had nothing changed, but because it's that intermittent of what I need more of or what and when I need less, it changed the date of when I would need my battery changed, and it added 6 months to that total.
Okay, got it. Oh, so you knew what David was asking. About the battery. Okay. And that gets into another question. Someone asked if you needed new leads or any new hardware.
Nope, nope. It was all the standard device. There was nothing invasive about it. I had no surgeries, no new anything put in there. It was all the same equipment that I had. It was really a matter of the doctor changing a setting on my device and then figuring out that threshold, the upper and lower, and where my symptoms hit on those markers. So yeah, it was for me. It was seamless. Other than how the device would respond to different events that I would have.
Okay, got it. And I have a message from DBS, from Medtronic. They said, no device replacement. The Adaptive DBS is a software upgrade that your physician can activate if you have the Percept DBS device. So we also put in the chat some links to the Medtronic site. And again, encourage everyone to talk to your healthcare team for any specific medical questions. But I do have some more questions for Brandon. Um, okay, IPG, implantable pulse generator. Now I know. I learned a new acronym today. Thank you. Okay, so Sheila, hi Sheila. She wondered about gait and balance. So even though the DBS doesn't help with your balance, is what you said, does it affect your gait in general?
For me, it did help my gait, just because again, I I I'm not sure exactly how to explain this, but when they first turned me on, um, my my neurology nurse practitioner was in there, and she said that be careful when I get up to start walking because I'm going to feel like a baby giraffe. And I didn't know exactly what she meant by that, but when I got up to do the walk down the hallway, I was, I mean, everything was looser and I didn't feel, yeah, it definitely helped my gait. But the balance improved over time with my physical health improving, um, because I was able to do so.
Thank you. Okay, another question from Mary Louise. Does it help with fatigue?
Um, for me, I, I'm not sure that again this may be one of the, and again this is just me, but I think part of the lifestyle change that it made available to me helped with the fatigue. Um, I I learned full well that a body in motion stays in motion, and one that doesn't, you're tired and sore and things of that nature. My fatigue. I will tell you when I was before DBS, I had to schedule myself an hour in the afternoon, like block out in my Outlook calendar so that I could take a nap in the afternoon. And I do still get tired, you know, but I work out for 2 hours a day and, I'm mowing grass, I'm doing life things. So I still have Parkinson's, so yes, I still get a little more tired than most people, but I think it improved for me. But again, I think it was a byproduct of affording me the ability to get myself a little closer back to who I was.
That exercise gym rat that you mentioned. Mhm.
Yeah.
And let's see. So, okay, do you notice differences in your speech at all?
Mm, the only time I notice a difference in my speech is when I'm tired. Um, later in the day, I'm a little slower with my speech, but I can't say that it changed either way for me.
Okay. Well, we asked you lots of questions, and I'm sure in support groups, your people probably are also always asking you to share your experience since you were one of the first people to have adaptive DBS in the country. Are there any questions that people never ask you that, what do you want to say to people that we didn't cover? Anything?
Hmm, that's a good question. Well, one thing, and I don't know that it relates completely to DBS or not, but the disease state of Parkinson's, um, for me, you know, I would recommend to anybody who is hesitant to join a support group to definitely join a support group. I mean, the DBS for me was life changing physically, but because I was able to start going to the gym and start going to some of these Parkinson's programs, I have met some absolutely amazing people, and I underestimated completely how important that sense of community was. I was very much of the ilk of, especially being young onset. I didn't want to be around anybody with Parkinson's. I didn't want to see what my future would look like, and I was completely wrong. Like, the support groups, be be active in the support groups, find your tribe, and take care of yourself as best you can, both physically and mentally.
Wonderful. Well, what great closing thoughts. Thank you very much, Brandon, for sharing your story and appreciate our partners at Medtronic. Um, and thank you to all of you for your good questions and your good attention. We couldn't get to everything, but I want to share that both on the Medtronic website or on PMD Alliance's website, we have a lot more of that, those details about DBS and about adaptive DBS. So today was the story and the personal touch and encourage everyone to keep doing their research, talk to your doctor if this is something that you're interested in. And couldn't echo Brandon's closing sentiments more about staying social, staying engaged, staying active physically and mentally, joining us at PMD Alliance to learn in community with everyone together. So thank you again, Brandon, and thank you everyone for joining. And I invite you, if you have your camera off, research shows that eye contact is good for the body and soul. So I invite you to turn on your camera and we'll do a moment of gratitude and happy smiles to say thank you to Brandon and thank you to everyone who joined today. So,
Thank you, everybody. I
thank
appreciate the
you.
opportunity.
All right. Have a great afternoon, everyone.